Hashtag I'm from Denver, and I might as well just say this is like a hymns. It's like a hymns episode where it's like, and for females too, but
a hers episode.
We're just. If you're feeling fatigued and things are just, your body feels different. And you talked about before, introspective, right? Like where it was like you get to learn a diagnosis on yourself to be like, what's different in me? If you're feeling this right now, you need to watch this episode. It's Real Talk, Real Doc. Hashtag I'm from Denver with Dr. Dan Bennett. I'm Producer WIGNZ. And Doc, we're talking about it because I think you were talking to me personally when you were saying half these things, because you're seeing hormone imbalances in men and females that's affecting their day-to-day life.
Well, yeah. So I have women come in and say, I look like $1 million and I feel like a prairie dog. Okay, a piece of prairie shit.
Well, prairie dog.
I feel like a prairie pile, right? That's what we should use, prairie pile. And they're right. They look good, but they're not feeling good, right? Joints are hurting, legs are aching. They just don't feel good, right? Well, that's a pain problem, right? Okay. But why don't they feel good? Well, the reason they don't feel good is because they're approaching 40, right? They're in that certain early changes, right? Hormones are not in right balance. You've had 3 kids, right?
That doesn't help,
It doesn't help. And so now, what's the symptom? Right? You come in, mom's fatigued. Moms don't want to be fatigued.
Yeah. I mean, they got a full day ahead, and they're still grinding even when they are fatigued.
And they push through it anyway, right? They push through it anyway because they have to, right? They got to be a super mom. They got to be a super career woman.
Super wife.
Everything. Super wife. No, that's right. Why do you think they go and sit in a salon for 2.5 hours?
Yeah.
It's not just for them. Yeah. It's for their husband. It's for their kids. It's for their friends. So when they come in and they go, I can't focus. I just can't focus. I'm at work, and the last thing on my mind is doing a good job. I wake my kids up in the morning. I'm tired before they get off to school. Well, that's not normal, right? My hair's starting to thin. It's starting to fall out. It's just not normal.
Yeah.
Okay, you need to come and see me. There's a problem. It's a pain problem, number one. Number two, it's probably hormone
not necessarily
imbalance.
physical pain. Like, what do you when you say pain problem?
Pain is both mental and physical.
Okay, that's cool. I mean, I guess you don't really think of it like that.
Right. Well, if you're depressed, that's painful, isn't it?
Yeah.
Right. If you're anxious, that's painful.
That's why you're the doc.
Okay. If you have PTSD, that's pain.
Yeah.
All right. It's not pain you see; it's pain you feel. And both are as important. You're a human being. You need to be active mentally and active physically.
So you're in pain. You acknowledge that, and you come in, and what happens then?
Well, now we need to do the workup. We need to find out why. Yeah. Okay, so
but people aren't comfortable with talking about.
Of course they are.
Oh, okay.
That's why I tell everybody before you see me, be introspective. Right? Yeah. Sit down with a cup of coffee or your favorite drink at night.
Yeah, because you're a doctor. You're not psychic. You can't.
No. And so I love psychics, right? If you're a true psychic, call me. Yeah. Right? But if you need a doctor, call them. Yeah. But, I think what we need to do is sit down, be introspective. Come up with a list. What's not normal?
Yeah.
All right? Women's list are going to be totally different than a guy's list. Totally different. Yeah. We think differently, but that's why we get along, right? It's a little yin-yang. And so sit down and write down your problem.
Okay.
Whatever it is.
Then you write it down and you come to see.
Come and see me.
Okay.
Right?
Dr.
And then we'll
Dan.
talk about the problem. This is a sage in medicine.
But that's hard for you, right? I mean, because you have to. I mean, they're basically giving you almost like an equation and numbers you've never seen before. Maybe they're your patient, maybe you haven't seen them before, but it's like, and you have to almost read their handwriting, determine their story, and that's a hard thing to diagnose.
Yeah, that's true. But a sage in medicine. This is an older guy that I had as a professor. He was probably 80-something years old when I was a medical student. Mm-hmm. That's 35 years ago. Okay.
Said you look great, Doc.
Yeah, but he said to me, the best thing you can do as a physician is let your patient talk for 5 minutes. They'll tell you what's wrong. If you rush into a room and you think you're so important that you're that busy that you can't listen, folks, find somebody else. They're not doing you a service. The best physician will sit and listen because you will tell your own problem from your own perspective, right? A little guidance with a few questions, a little funnies and discussions, that'll bring it out, but you know your problem. What you have to be able to do is introspectively tell me. Okay? So, for instance, a guy's not going to talk about sexual dysfunction. What do guys talk about? Politics, sports, and their kids and family. That's it.
Yeah.
That's the limits, dude.
Yeah.
So if you're having a problem, it may take 1 or 2 times before you're going to share
But the wife
that.
will talk around
Oh,
about
right
it.
away. Your wife will tell me everything, okay, before your appointment. All right?
Yeah.
And so that's just the difference between guys and women.
Okay, so you diagnose it, you do the equation for them, you help them, and then what happens next? You're just able to recommend the right type of therapy? I mean, that's got to be...
Well, so usually, if we're talking about hormone imbalances, okay, whether it's thyroid, testosterone, estrogen, progesterone, those are a little bit more difficult to tease out. You need some lab work, right? I need to ask you some detailed questions that may be a little personal, okay? So if you talk to a woman about vaginal dryness, that's a personal question.
Oh, yeah.
Now, when they look at you and go, oh, yeah, I'm having trouble, okay? How many people ask their patient that?
Hopefully Facebook didn't block us right now because of that.
That's treatable.
But yeah,
okay?
but most people aren't talking about that.
Let's talk about a guy.
Talk about it,
Let's focus here, guys. If I ask you, are you having trouble getting it up in the morning? What do you tell me? Okay, that's a personal
I drink some
question.
coffee and I'm good.
That's a personal question.
But as a guy, I'm going to give you
Of course you are, because guys don't talk about that. Yeah. But when you're in a one-to-one MD situation, right? You got to say that. You got to say what the problems are because they're fixable. This is not something you should walk around with or be ashamed of. I wouldn't talk to your friends about it, but you certainly should talk to someone like me about it to say, what's my solution? What can I do?
So this hormone treatment, is it new? Like,
No.
No, it's been around forever.
No.
Okay, like I guess I'm just. It's not until you get older that you kind of experience these
Think
problems.
about it. But for instance, let me give you an example. I've treated guys who are in their late 20s, early 30s. They've been in severe motorcycle accidents, multiple concussions, other things, right? Sports related, etc. They have low testosterone. Well, that's because their brain has changed. They're not telling their body to produce enough testosterone. That's because of their head injury.
Oh,
right?
wow.
So they're wondering, why don't I
they
feel
would
like...
never think that, ever.
And so they're like, why is my wife not exciting me? Why can't my girlfriend make me feel special?
Yeah.
Well, it's not your fault. It's because of all the head injuries you've had.
Wow.
That's treatable. That's a good medical example of low testosterone. Let me give you another.
That is why you have to make that list and acknowledge that you have those things.
Let me give you another example, okay? Here's a woman who comes in. She's a mom of 45 years old, okay? Her kids are in their teens. And she says, I just don't feel good, right? I get up in the morning, I'm cold. I go to bed, and I'm cold. I'm tired all the time. I have no energy. I don't feel like having any sex. I don't feel like doing anything. I just do what I have to do like a machine because I have to do it. I'm a mom. Right? Well, then you look at her hormone panel, and she's perimenopause.
What do you mean hormone panel? Like
so there's blood tests we can do to figure out where are you, okay?
The age and all those things,
And so we find out, the hormones are a little bit off, but you know something, you're also hypothyroid. Oh, guess what? Her mom was, aunts are, sister is. You never thought about it.
Okay.
All right? Those are things that are treatable, all right? But the complaint to me is I don't feel good. Right? My joints hurt. I'm fatigued all the time. My muscles ache. I just feel like bleh. Right? And so we could do something about the blah. Right? And that's...
Don't feel blah.
Don't feel blah. But that's where hormone replacement can be a medically necessary treatment to bring you back where you need to be.
So how do they get that treatment? What's the best?
First of all, don't get it from a schmuck on a corner or in your back of the garage. Okay,
don't buy it from me.
No, you need to see a real doc. All right, I don't care.
That's real talk.
That's real talk. I don't care which MD you see, which DO you see, but you need to see a real doc for an assessment because there may be other problems. Right? I've treated people where we pick up early cancers and they get better. I have other issues where they pick up a genetic problem. You need someone who understands the whole picture. All right? Not just your chief complaint. Who can then work with you and work with other specialists to bring you back where you need to be.
Well, the best thing about Real Talk, Real Doc, hashtag I'm from Denver, is we have all of our episodes, and you can get the podcast episodes wherever podcasts are available, but you can actually watch these episodes on imfromdenver.com/Real Talk, Real Doc, and we're going to have blog stories up. We do have those up, health stories, but you can get more information on this, and we'll give you Dr. Dan's information so that you can potentially, if you make that list and you want to come see him, you can reach out.
And with Real Talk, Real Doc, remember, it's any medical questions, anything to do with medicine, we're here to answer the question, or at least to turn you on to the right source to answer your question.
Well, you're here to answer them. I'm just making sure that they can hear you. That's all. Hashtag I'm from Denver. Thank you guys for watching. Until next time, Real Talk, Real Doc with Dr. Dan.
Real Talk, Real Doc with Dr. Dan.